Hello everyone. Today we will be discussing the third important part of pharmacokinetics, that is metabolism. So this metabolism and excretion, this come under drug elimination. So what is this elimination? Elimination is the stoppage of action of drugs, and this includes both metabolism as well as excretion. So this metabolism is also known as biotransformation. Okay. So what is the fate of the metabolism? There can be four cases. So the first case is, which is usually the most common, that is the active drug is converted into the inactive metabolite. Second is the active drug can be converted into the active metabolite. Like for example, in this table it is given morphine is converted into morphine 6-glucuronide. Next example of this is cefotaxime is converted into deacetylcefotaxime, allopurinol to alloxanthine, imipramine to desipramine, and amitriptyline to nortriptyline, and so on. So another thing is that third case in which the inactive drug is converted into active metabolite, or in other words, these are known as prodrugs. These are known as prodrugs. And these prodrugs, what is meant by this? These prodrugs are the drugs which are given in inactive form, and it's converted to its active form in the body by metabolism. So what are the examples of these prodrugs? You can remember it by the mnemonic: a playful dog may dig in cool sand. So for A, we'll remember ACE inhibitors, except two drugs, that is captopril and lisinopril. For P, we will remember proguanil, PPI, and prednisone. D for dipivirfin. M for methyl dopa, minoxidil, and 6-mercaptopurine. D for levodopa. Then I for irinotecan, C for carbimazole, clopidogrel, and cyclophosphamide. Phosphamide. S for sulfasalazine and sulindac. Okay, so these are the examples of prodrugs, and these drugs are given in an inactive form and are converted in the body to the active form. Next is active drug may be converted into a toxic metabolite by metabolism. So the examples of these are paracetamol is converted into NAPQI. Then isoniazid is converted into acetyl hydrazine. Halothane is converted into trifluoroacetic acid. Okay. So what is the main purpose of metabolism? So the main purpose of metabolism is to make the drug water soluble. So why to make it water soluble? Because once it becomes water soluble, it can be easily excreted from the body. So there are two phases of reactions that takes place in the metabolism. One is phase 1 reactions. The second one is the phase 2 reactions. Okay. So phase 1 reaction, what it does, it exposes the functional group of the drug, and it is a catabolic reaction. Okay. The phase 2 reaction, it makes the drug water soluble. It is anabolic reaction. Okay. So what are the phase 1 reactions? These are ORC, HD. Okay. Oxidation, reduction, C for cyclization, H for hydrolysis, and D for decyclization. Out of all this, the most common is the oxidation reaction. Okay. So the most common phase 1 reaction is the oxidation reaction. Next, coming to the phase 2 reactions. So the phase 2 reactions are, you can remember by means of a mnemonic, G3MAS. G3 mass you can remember. Okay. So in G3, you will have to remember glucuronide conjugation, glutathione conjugation, glycine conjugation. Then MAS stands for methylation, A for acetylation, S for sulfation. Okay, except for this glucuronide conjugation, all the other phase 2 reactions, that is glutathione, glycine, methylation, acetylation, and sulfation, these are by means of non-microsomal enzymes. Non-microsomal enzymes. So what is the difference between microsomal enzymes and non-microsomal enzymes? So as the name suggests, microsomal enzymes are inside the microsomes, that is the smooth endoplasmic reticulum. The non-microsomal enzymes are outside the microsomes, that can be either in the cytoplasms or in the mitochondria. These microsomal enzymes, they can be induced or inhibited. The non-microsomal enzymes, they can't be induced or inhibited. So what are the reactions that are catalyzed by the microsomal enzymes? All phase 1 reactions and along with that glucuronide conjugation. The non-microsomal enzymes, they catalyze all the phase 2 reactions except glucuronide conjugation. Okay. So next coming to what are the various enzymes inducer and inhibitors. Certain drugs, they increase the activity of certain enzymes and they are known as the enzyme inducers. So what are these drugs? We can remember it by means of mnemonic GPRS cell phone. For G, we'll remember griseofulvin, P for phenytoin, R for rifampicin, S for smoking and St. John's wort, C for carbamazepine, and P for phenobarbital. So these are the enzyme inducers. GPRS cell phone, griseofulvin, phenytoin, rifampicin, smoking and St. John warts, and carbamazepine and phenobarbital. Next, coming to the enzyme inhibitors. So what are the enzyme inhibitors? You can easily remember by means of mnemonic. Vitamin K can't cause enzyme inhibition. Okay. So vitamin K, we can remember valproate and K for ketoconazole. C for cimetidine. Another C for floxacin. E for erythromycin and I for isoniazid. Okay. So enzyme inhibitors are valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin, isoniazid. Now coming to what are the drugs that are metabolized by acetylation and glucuronide conjugation. These are important as from the MCQ point of view. So the drugs metabolized by acetylation are HIPs, HIPS. H for hydralazine, I for isoniazid, P for procainamide or PAS, S for sulfonamide. So these are metabolized by acetylation. Coming to the drugs which are metabolized by glucuronide conjugation. So the drugs metabolized by glucuronide conjugation can be remembered by means of mnemonic CAMP bio. So C for chloramphenicol, arzenavir and atorvastatin. M for metronidazole and morphine. P for paracetamol. B for benzodiazepines. I for irinotecan and O for usipils. So these are the drugs which are metabolized by glucuronide conjugation. Chloramphenicol, atorvastatin, adzenavir, metronidazole, morphine, paracetamol, benzodiazepines, irinotecan, and usipils. So in the next lecture, we'll be discussing what are the various CYPs that are involved in the metabolism or cytochrome P450 enzymes which are involved in the metabolism. Thank you.